This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. I think we all kind of enjoy and pride ourselves taking care of stroke patients, and kind of part of the initial stroke decision process is whether someone's a candidate for a thrombolysis. Do we give them TNK? Are they candidates? And, that's a long-standing controversy of the benefits of thrombolysis, potential harms, but there's a small area that's especially controversial, and that's thrombolytics for minor strokes. So somebody comes in, let's say we think they have a stroke, but it's, numbness, and it's not a debilitating stroke. The NIH Stroke Score is low, like less than 5. Is there really a benefit to giving thrombolytics? There's definitely a risk of harm. There's a risk of intracranial hemorrhage, other bleeding. So there's been a couple small studies that have looked at this, and the initial studies, the big studies that showed that maybe there's benefit to thrombolytics excluded the patients with the most minor stroke. So there hadn't been really great data. So there was a recent good study, randomized a large number of patients who had these kind of specifically minor strokes, NIH Stroke Scores less than 5, to either get thrombolytics, in this trial was alteplase, which we used to use, compared to dual antiplatelet therapy, so Plavix and aspirin. And they basically followed them to see if there was a difference in outcomes, and there was not. So whether you got alteplase with the potential risks, or you just got aspirin and Plavix, which is theoretically safer, patients did just as well. So this is a fairly recent trial, and we might see when we have some patients who are definitely a stroke, but still very minor, that maybe they're not getting the more aggressive thrombolysis and maybe just getting aspirin and Plavix and being monitored, because the recent trial showed the benefits were pretty equivalent. So interesting stuff. All right, thanks. Have a great day.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.